the idea with this chemotherapy plus immunotherapy combination is that chemo is a very good way to induce damage in tumor cells that may signal eat me signals for the immune cells to come in and recognize the tumor as being foreign, and do a better job of priming T cell formation that can then be activated by checkpoint inhibitors. And doxorubicin is sort of this classic drug in a variety of cancer models that has been shown to induce something called immunogenic cell death, which essentially means it induces signals very similar to what's induced by viruses that tell the immune system to, particularly the early innate immune system like macrophages and dendritic cells, to come in and recognize that there's an insult happening and stimulate long-term immune responses. So what we did was we performed a phase 2 clinical trial. This was not randomized, where patients received doxorubicin with PD-1 and CTLA-4 blockade. Now, unlike Balstilimab, Zalifrelimab is a first-generation CTLA-4 inhibitor, and then Balstilimab, of course, is the PD-1 inhibitor. So, we initially had designed the study, which is a Simon 2-stage design. So it was done in 2 parts. The first stage, patients got a dose of PD-1 and CTLA-4 first, and then 3 weeks later, they started the chemotherapy along with continued immunotherapy. And what we saw in that first half of the study was that more than 50% of patients actually got responses to treatment, which is really exciting, because that's a little bit clunky and was a little tricky for determining endpoints, as well as we saw patients that were progressing when they came off the chemotherapy and went on maintenance. We had made a couple of changes where everybody was getting chemotherapy and immunotherapy all at the same time, starting on day 1. And when we did that, the second half of the study, the response rates were down to about 7%. So again, it's unclear. We can't prove in this type of study whether it was the priming with immunotherapy followed by chemo that made a difference, but it's certainly something we're very interested in. Regardless, across the board, we saw responses again in tumors that were hot, that we would expect, treatment to work very well. And some of these were near complete responses, long-term durable responses, essentially cures for these patients. But then also, we saw tumors that should never have responded to immunotherapy or doxorubicin actually getting nice durable responses. So, we're excited. We have an ongoing cohort on this trial that actually is combining doxorubicin with Balstilimab, the next generation CTLA-4, along with PD-1, to sort of take advantage of the improved features, the better immune priming that we think happens with the next generation Balstilimab. So that data is ongoing, and we'll be planning to present the entire study in the future. But it really does set up nicely for a potential randomized study, hopefully in the future.